Good afternoon. My name is Cynthia. I'll be performing my head to toe assessment today. That's my patient. Just a scan of the room. Those are my instruments I'll be using. So this is the room. Just going to position my camera. Okay. I wash my hands. I use my sanitizer. So I'm just going now to clean my stethoscope with spirited swab. So I'll perform hand privacy. Okay, so sir, my name is Cynthia. I'll be a nurse for today. I'll be performing a head to toe assessment. Is that okay by you?
Yes.
All right. So can you tell me your name, please?
My name is Itani Komo.
Okay, I just confirmed the patient's ID. So do you want to use the washroom?
No, I'm fine.
Okay. So sir, I'm just going to begin with general survey. Can you tell me how old you are?
I'm 36 years old.
Okay, the patient appears as stated age and is looking at him. His sexual development is appropriate to his age and gender. His height is good. So moving on to his behavior, I see he maintains good eye contact. His mood is appropriate. He sits comfortably and is cooperative. His speech is fluent, and I see his hygienic condition too is good, and he dresses appropriate. So now I'm just going to check his mobility. Please, sir, can you stand up for me?
Sure.
Can you move like 2 steps? Okay. So his gait is smooth and even, and no altered range of motion, and is well balanced. I see that. So I'm just going to check his work of breathing. Observe it for some time. So no labored breathing and no sign of respiratory distress. So sir, do you know where you are?
I'm at the hospital.
Okay, do you know the date of today?
Today is April the 6th.
And can you tell me your full names, please?
Itani Komo.
Okay, so my patient is alert and oriented to time, place, and person, and he has proper behavior and speech, and that's as I see. So I'm just going to start with inspection of the head. So I'm starting with the scalp and the scar. On inspection, I see the shape of the hair is round, of the head is round, and it has the scalp has good hygienic condition, and it's symmetrical. I'm just going to palpate now. No lesions, no bumps, no bruises, no edema, no swelling. So moving forward to inspect his hair, I see his hair, he just shaved his hair, but he's partially bald in front of his head, which is okay, which is normal. And looking at it, I haven't seen any infestations on the hair, so which is good. I'm moving on to his face. Looking at his face, I'm inspecting his face now. I haven't seen any lesions on the face, no swellings of the face, no involuntary movement of the face. I'm just going to palpate the face now. Do you feel any pain?
No.
So no tenderness. The texture of the face is soft and smooth, and the skin sugar too is good. His color matches with his ethnicity, so his face too is warm to touch, which is good. So I'm just going on to check to inspect his I'm going to do the cranial nerve 7, which is the facial nerves. So sir, can you smile for me? Can you chew for me, please? Can you lift up your eyebrow? Can you clench your teeth? Can you puff your jaws? So the facial nerves is good. It looks everything looks good at this point. So I'm just going to check the eyes straight away. Looking at the eyes, the eyebrows are symmetrical. The lashes are even on both sides. I haven't seen any discharge of the eyes. The conjunctiva is nice and pink, and the sclera too is white. So I'm just going to check for oculomotor nerves, cranial nerve 3. So I'll be using the acronym PERLA. So I'm just going to check the size of the eyes on both sides. So 3 millimeters on the left. The pupil is 3 millimeters on the right, which is equal, and it's round. And I'm going to check for reaction to light. I'll do the consensual test. So the pupils dilate on the left, pupils dilate on the right. I'm doing the direct light reaction. Both pupils dilate at the same time, so his eye is reactive to light. And I'm doing the accommodation test now. Please, can you look at this object, Miss Title? Okay. So the pupils contracted, and which means his eye, the pupils are accommodating. So which is a positive, a good sign, and it shows the oculomotor nerves is functioning well. So right now I'm just going to the ears. So on inspection of the ears, I haven't seen any, they are symmetrical, and no cerumen outside, no discharge on the left, no discharge on the right. I'm just going to palpate the auricles and the trigons. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay, no pain on the auricles and the trigons. So now I'm going to do the whisper test. Can you close this side of your ears, please? I'm going to say 3-syllable word. Please repeat after me what you hear.
I love you.
Can you close the other side?
How are you?
So he has the sense of hearing is good, which is fine at this point. Everything at this point looks normal. So I'm going down to his nose. Looking at his nose on inspection, it's symmetrical on his face. And can you flare your nostrils for me? So he can flare his nostrils, which is good. And now I'm just going to check if it's potent. Okay, the nostrils are potent. And so I'm going to palpate for the frontal sinuses and the maxillary sinus. Do you feel any pain?
No.
Any pain?
No.
So no pain on palpation of the frontal and the maxillary sinus. Now I'm moving straight to the mouth. I'm using this as my tongue depressor. I'm just improvising. Looking at his mouth, his lips looks it looks hydrated, which is good. I haven't seen any lesions on his lips. Please, sir, can you open your mouth for me? Your gum, can you open your teeth? So no bleeding on the gums, no swellings, and his mouth look hydrated. Presence of teeth, which is a normal finding. Please, can you open your mouth, your tongue? Okay, there is good movement of the tongue, and it's hydrated, and it's also symmetrical. So I'm going to check the hard and the soft palate. So in there, the soft palate is pink, and both soft and hard palate are pink, and no lesions as I see, which is good. So I'm going to check for glossopharyngeal and the vagus nerves. So can you open your mouth, say ah,
Ah.
ah,
Ah.
So there I see movement of the vagus and the soft palate, which is a normal finding. So I'm going to check now for hypoglossal nerve. Can you say light, tight, dynamite?
Light, tight, dynamite.
Can you send your tongue on the side like this? So no tremors, and I see normal findings of the nerves, of the hypoglossal nerves. So now I'm just going to check the neck. Looking at his neck, the color, it matches with his ethnicity. I don't see any tenderness. I don't see any lesions, no bruises, and there's equal hair distribution on the neck. I see. I'm just going to palpate right away. Do you feel any pain?
No.
Okay, his temperature is warm to touch, no tenderness. And okay, I'm going to check for enlargement of the thyroid gland. Can you just bend your neck? Any pain?
No.
No enlargement of the thyroid gland. Okay, so now I'm just going to check for the carotid artery. I'm going to do it one at a time because I can't do it now so the patient doesn't pass out. Good. Okay. The pulse is strong and regular. It's at +2, which is a normal findings. So at this point in time, I'm just going to check for spinal accessory nerve. Can you bend your head like this? Good. The other side. Your shoulders, can you lift them up, down? So I'm going to do this against resistance. Against resistance. Okay, everything looks good. I'm going now to do his upper body, the hands. So still looking at his hands, I see it's symmetrical, equal hair distribution, no lesions, no bumps, no bruises. The color of his hands matches with his ethnicity. I'm going to palpate right away. Do you feel any pain?
No.
So no tenderness, good texture, good chew gut too, and I haven't felt any masses or no deformities of the upper extremities. So now I'm going to check for capillary refill. It is prompt and in 2 seconds, which is a normal findings. So now I'm going to check for radial pulse. At this point I'm going to count, so I'll do that bilaterally and simultaneously. So the pulse is 70 beats per minute, which it's regular, and it's at 2+, which is a normal finding. So this is good. Everything looks good at this point. So I'm just going to check for the grip, hand grip. He has very good resistance. Everything is perfect at this point. So I'm moving forward now to musculoskeletal system. So please, sir, can you stand up for me, please? Okay. Can you flex your fingers? Extend. Your ribs flex. Extend. Your elbows flex. Extend. Pronate. Supinate. Adduct. Abduct. Adduct. Okay, that's good. Everything looks good and no ulnar deviation, no crepitation, and the range of motion is good. So I haven't found any range of altered range of motion, which is good. So I'm moving now to the lower peripheral. So going to his legs. On the inspection, I see it's symmetrical, equal hair distribution. The color is matches with his ethnicity, and no lesions, no bumps, no bruises. I'm just going to palpate. So do you feel any pain?
No.
So no tenderness, no edema, no deformities. Okay, everything looks good. I'm just going to check his capillary refill. Okay. It's prompt in 2 seconds, and which is a normal findings. At this point, I'm going to check the posterior tibialis. The posterior tibia pulse, which is found just in between the bone of his ankle, the posterior bone of his ankle. So I'm going to check that simultaneously. Okay, it's good. And now I'm going to check the dorsal pedis, which is just lateral to his big toe at the tendon. So at this point, everything looks good. The pulse is regular, it's strong at +2, and he was equal on both sides, so which is normal findings. So at this point, I'm just going to can you dorsiflex your legs, like dorsiflex up, pantaflex, the other leg, dorsiflex, pantaflex. Okay, perfect. The test was good. No abnormalities found at this point. So sir, can you turn your back? Okay, so I'm just going to continue to the thorax and the lungs. Can you lift up your chest for me, please? Okay, so on inspection, the posterior thorax looks symmetrical, no scars, even distribution of hair, and no lesions, no skeletal deformities, and the anterior posterior diameter is less than the transverse diameter at the ratio of 1:2, which is a normal findings. Okay, I'm just going to auscultate now. So I'm starting. Sir, please, can you just put your hands on your legs? Okay, just bend your head. Can you take a deep breath as I put this on your chest? I'm going to use a diaphragm of my stethoscope. So I'm starting at the left. So can you take a deep breath? I'll take one full circulation. Can you take a deep breath? Good. Deep breath. Okay. So I was observing his breathing is like 17 breaths per minute, which is a normal findings, and it's regular. I didn't get any extra sounds, which is good, and the pitch and amplitude seems moderate, which is a good findings. So everything is normal at this point. There is no adventitious sounds heard. So now I'm going to check his going to assess his cardiovascular system. So at this point, I'm just going to I'm going to auscultate the cardiovascular system. For the posterior system, actually, I was supposed to, can you excuse me? I don't know if I palpated, so I'm just going to palpate this because I omitted that. So his body is warm to touch. Do you feel any pain?
No.
Okay, no tenderness, no abnormalities, no the skin color is matches with his ethnicity, which is good. Please can you turn the other side? So I'm starting with the aortic valve, which is at the right of the second intercostal space of the sternal border. So I'm going now to the pulmonary valve, which is at the second intercostal space at the left of the sternal border, which is opposite to the aortic valve. Now I'm going to the Eppes point, which is on the left of the third intercostal space of the sternal border. I'm going to check down the tricuspid valve, which is on the left at the fourth intercostal space of the sternal border. And now the mitral valve is still on the left, but at the mid-clavicular line of the fifth intercostal space. So everything looks good. No murmurs, no extra hard sounds felt. So these are normal findings. I'm going to check for apical pulse. The apical pulse, which is on the fifth intercostal space of the mid-clavicular line. So I'm just going to count that. So it's 70 beats per minute. It's regular and it's strong. So yeah, the normal findings. Now moving to the abdomen. So please can you lie down? I'm just going to do my draping. Okay, I've done my draping. On inspection, the abdomen looks round. There's good equal head distribution, and there is the umbilicus is at midline of his abdomen, I've seen presence of peristaltic movement, which is good findings. And now I'm just going to auscultate. I haven't seen any lesions. So for the abdomen, you auscultate before you palpate. So I'm going to auscultate. I'm starting with the right lower quadrant to check for abdominal, for bowel sounds. So I move now to, okay, I'm auscultating the 4 quadrants of the abdomen. All right, so there's presence of bowel movement. Everything looks normal at this point. Now I'm going to palpate the abdomen. I'm going to palpate the 4 quadrants of the abdomen. Do you feel any pain?
No.
So on palpation, no rigidity, no superficial masses, and no tenderness. So these are normal findings, so everything is fine. So I'm just going to palpate the bladder. Do you feel any pain?
No.
So the bladder, no pain, and it looks empty, no tenderness at the bladder. End of assessment.